Hello, I am Dr. Sanjay Dhawan, Director and Head of Eye Department at Max Healthcare. Today, I will talk about headaches. Headaches are a common ailment affecting a lot of people in their routine life, and if they are recurrent and severe, they can adversely affect the quality of life. Headache is basically a pain in the area of head, face, or neck. There are many different types of headaches. There are primary headaches, where the headache in itself is a disease. There are secondary headaches which are caused by other diseases and other ailments. Then there are headaches which are called cranial neuralgias caused by involvement of the cranial nerves. But what are the common types of headache, or what are the common causes of headache? Stress headaches are very common. So are the headaches caused by visual strain or eye strain. And then comes the migraine or cluster headaches. Other headaches like headaches caused by depression, ENT disorders, eye diseases, blood pressure, brain tumors, neck involvements, fevers, viral infections are less common. So what do we do in case we get headaches, especially if we get recurrent headaches? The first person to consult should be an ophthalmologist or an eye specialist, because eye diseases are a very common cause of headache. And also, an ophthalmologist will be able to diagnose the headaches caused by stress or migraines. If an ophthalmologist finds that the headache is caused by something else, he may be able to refer you to a proper or a concerned specialist. There's no need to straight away jump on to get a CT scan or MRI scan done, because headaches caused by brain tumors and all are rare. However, if the ophthalmologist feels the need for that, he'll be able to refer you to a concerned specialist or advise the required investigations. The common headaches of stress, visual strain, migraine are often mixed up. That is, that these can coexist in some individuals. And most of these headaches can be prevented, or the severity and frequency can be reduced by taking some precautions, which is what I'm going to talk about today. So, people who get frequent headaches, what should they do? There's an immense need for leading a very disciplined and organized, simplified life. So, lifestyle changes are what is really required. So, here are some of the precautions which a person needs to take, to prevent those headaches. First and foremost, adequate timed sleep is important. We must sleep 6 to 8 hours every night, more in case of children. Regular timed meals are very important, and delaying or skipping a meal is a very potent trigger for causing headache, especially the breakfast. Breakfast often tends to get ignored, skipped or delayed. That should not happen. So breakfast, lunch, dinner, evening snack should be on time, even if it is a small meal. If you happen to wake up early in the morning or sleep late at night, you should take a late night and early morning snack as well. Adequate hydration or intake of water is extremely important. We should ideally start a day with a glass of water and then take water with every meal, and also more frequently if you're doing more of physical activity. Regular physical exercise and sun exposure is extremely helpful in prevention of headaches, whether they are migraines or visual strain or stress-related headaches. We must make an effort to do a cardio exercise on a daily basis. We must expose ourselves to at least soft sun for at least half an hour every day. Visual rest and eye exercises are extremely important in preventing the headaches caused by eye strain. These days we spend a lot of time on the screens, which in turn cause a lot of visual strain and a cause of headaches. Every 15 minutes we must close our eyes and give it a minute's rest. Every hour or so we should take a longer break. We should cut down our screen time in the day to the minimum possible. But we should also do regular convergence eye exercises and rotational eye exercises, or the eye yoga. I have explained those exercises in a different video. You can look for that on my channel or my page. Relaxation or meditation. Some form of meditation or a relaxation technique should be part of your day. Whichever type of meditation or relaxation appeals to your heart, you can follow that, because that is what you'll be able to pursue regularly. And whether it's meditation or just sitting, relaxing, listening to some music in a soft light, or reading a short book. So choose whatever appeals to your heart. Certain food items triggers headaches. For example, chocolates, beetroot, cheese, red wine. If in case you find a correlation, then cut down the consumption of that food item. If you still get headaches with small quantity, also you can stop those food items. Stress management. There are stressful stimuli in everyone's life, whether it's the stress of work or stress of family life or stress of the world on the whole. And those stressful stimuli will always be there. But these stressful stimuli are not what actually causes stress in us. What causes stress in us is our response to these stimuli, how we respond to them, how our body responds to them. And it is that response that we should try to modify and subdue. So if you ever find something stressful around you, do not react, do not respond to them as in a knee-jerk fashion. Quieten down, take a few deep breaths, delay your response, think about your response, think about this situation, think about what caused this situation, and then respond to it. There's a chance that your response will also be mellowed down and you will not feel as stressful. Avoid loud sounds, bright flashing lights and crowds, because they can also lead to headaches. And take some time off from your work regularly for a relaxed holiday. Plan your life, your day, your finances well, so that you have enough time for yourself and for your family. If you follow all these precautions and all these steps, I'm confident that the frequency and severity of headache will come down to a great deal. Thank you very much.